All right, so let's start with the big story that is emerging from South Korea, where more than 50 patients who reportedly were deemed to have completely recovered from the COVID-19 infection have now tested positive once again. So let's try and explain as to how this may have happened. Now, over the course of the last few days, multiple patients were released from quarantine centers in the North Gyeongsang province. Now, 51 of them, however, have now tested positive yet again, and this is due to what is now being described as the reactivation of the virus within their bodies. A COVID-19 test reads the virus markers in a human body. Now, experts say that these markers can actually fluctuate over a period of time, and sometimes they are so low that the tests actually come back negative. And this is what seems to have happened with these 51 patients in South Korea. The scientists have assured the public that this is not a case of survivors having contracted the virus yet again from an external source. Now, this particular instance has also raised some important questions about how efficient the rapid testing kits are. Now, South Korea is also contemplating a rather controversial surveillance measure. The government is thinking of electronically tagging people once they are released from quarantine, and activists say that this would be a violation of an individual's privacy. Now, the plan is to connect electronic bracelets to mobile phones via Bluetooth. The system will alert authorities when the distance between the bracelet and the mobile phone crosses a particular threshold. And now, to give us more insights into what is happening in terms of these cases, we are joined in by our correspondent Bruce Harrison, who's now joining us live from Seoul in South Korea. Now, good afternoon to you, Bruce. This is rather an interesting, and some would in fact describe it as a bizarre case that has come to light, where 51 people who had been completely recovered of the COVID-19 infection have now tested positive yet again. What's happened in this case?
Right now, Mohammed, I think the government's trying to figure that out. Overall, I think they're more focusing on the fact that cases here continue to drop. Just Monday and Sunday, we saw 47 cases each day. This 50-odd cases that was confirmed on Tuesday and reported today, Wednesday, isn't a significant leap. Ultimately, they're trying to reinforce stricter quarantine measures and make sure that there's no new cases coming in from out of the country right now. Local transmissions still seem to be at a fairly significantly low level at this time.
Right, and at this point of time, what are the experts suggesting in terms of containing the spread of the COVID-19? If I'm audible to you, Bruce, if we could dwell a bit in terms of these 50-odd cases that have emerged in South Korea, what is the administration saying about them?
Mohammed, which cases in particular are you referring to? It's quite windy up here.
Right, the cases that I'm talking about are these 51 cases where people who had been discharged from a quarantine center and they have tested positive again for the COVID-19 infections.
Yes, and the government, like I said, is trying to understand the underlying causes of how this is possible at this time. I mean, there's still a lot we don't know about the novel coronavirus. There's no vaccine at this time. They're trying to figure out exactly what would have caused a scenario like this in these individuals coming from these quarantine centers.
All right, and also, what is the state of the restrictions in terms of the lockdown measures that were imposed? Is something like that being talked about right now in South Korea?
There's no lockdowns. There's no consideration for a lockdown right now because the overall case numbers have fallen, whether it's imported or locally transmitted right now. The government wants to avoid any kind of scenario like we saw in Wuhan or other cities around the world. The government has said time and time again they don't think that's an effective approach to fighting COVID-19, so they're avoiding that for the time being. Simply, they are just increasing quarantine restrictions. So I believe you mentioned that at the top of this bulletin that they were going to employ different tracking measures, whether it's a monitoring bracelet or continuing to rely on smartphones to make sure people stay within their quarantines. That's really about as strict as it's getting right now.
All right, we'll have to leave it there. Thank you very much indeed, Bruce, for joining us from Seoul and getting us those insights in terms of what is happening in South Korea right now.